Diabetes, a condition affecting millions worldwide. It's when the body struggles to regulate blood sugar. Insulin, produced by the pancreas, helps glucose enter cells. In diabetes, this process is disrupted, but with early detection and lifestyle changes, it's manageable. Diabetes is not just a personal health concern, it's a global epidemic. According to the World Health Organization, approximately 422 million people worldwide have diabetes, and this number is projected to rise to 642 million by 2040. The increasing prevalence of diabetes is linked to factors such as aging populations, unhealthy diets high in processed foods and sugary drinks, and sedentary lifestyles. The impact of diabetes extends beyond individual health. It places a significant burden on healthcare systems worldwide, accounting for a substantial portion of healthcare expenditures. The economic consequences of diabetes are far-reaching, affecting individuals, families, and entire nations. However, there is hope. By understanding the different types of diabetes, their causes, symptoms, and management strategies, we can empower ourselves and our loved ones to prevent or effectively manage this condition. Diabetes is classified into type 1, type 2, and gestational diabetes. Type 1 is an autoimmune condition requiring insulin. Type 2 is the most common, often undiagnosed for years. Gestational diabetes occurs during pregnancy and increases future risk. Type 1 diabetes, an autoimmune disease, typically appears in childhood or adolescence. The immune system attacks and destroys the insulin-producing beta cells in the pancreas. Without insulin, glucose cannot enter cells, leading to high blood sugar levels. Insulin therapy is essential for managing type 1 diabetes. Section 2. Type 2 diabetes, a metabolic disorder. Type 2 diabetes is the most prevalent form of diabetes, accounting for approximately 90 to 95% of all cases. It usually develops gradually over time, often going unnoticed until blood sugar levels become significantly elevated. Unlike type 1 diabetes, where the body doesn't produce insulin, type 2 diabetes involves a combination of two factors: insulin resistance and impaired insulin secretion. Insulin resistance occurs when the body's cells don't respond properly to insulin. The pancreas initially compensates by producing more insulin to overcome this resistance and maintain normal blood sugar levels. However, over time, the pancreas's ability to keep up with the increased demand for insulin declines, leading to impaired insulin secretion. This combination of insulin resistance and impaired insulin secretion results in chronically elevated blood sugar levels. Several factors contribute to the development of type 2 diabetes, including genetics, family history, age, ethnicity, and lifestyle factors such as physical inactivity and unhealthy eating habits. Section 3. Gestational diabetes, a temporary condition. Gestational diabetes is a type of diabetes that develops during pregnancy, typically in the second or third trimester. It occurs when hormonal changes during pregnancy affect the body's sensitivity to insulin, leading to high blood sugar levels. Gestational diabetes can affect both the mother and the developing baby. For the mother, gestational diabetes increases the risk of high blood pressure, preeclampsia, a pregnancy complication characterized by high blood pressure and protein in the urine, and the need for a cesarean section. Babies born to mothers with gestational diabetes are at an increased risk of being large for gestational age, which can lead to complications during delivery. The good news is that gestational diabetes usually resolves after delivery. However, women who have had gestational diabetes have a higher risk of developing type 2 diabetes later in life. Their children are also at an increased risk of developing obesity and type 2 diabetes later in life. Section 4. Understanding the differences. Understanding the differences between type 1, type 2, and gestational diabetes is crucial for proper diagnosis, treatment, and management. While all three types involve elevated blood sugar levels, Their underlying causes and treatment approaches differ significantly. Type 1 diabetes is an autoimmune disease requiring lifelong insulin therapy, while type 2 diabetes is a metabolic disorder often managed with lifestyle modifications, oral medications, and sometimes insulin. Gestational diabetes, on the other hand, is a temporary condition that typically resolves after pregnancy, but requires careful monitoring and management during pregnancy to minimize risks to both the mother and the baby. By understanding these distinctions, individuals can work with their healthcare providers to develop personalized treatment plans that address their specific needs and circumstances. Unraveling the causes. Type 1 diabetes. Type 1 diabetes arises from a complex interplay of genetic predisposition and environmental triggers. Certain genes make some individuals more susceptible to developing type 1 diabetes. Environmental triggers, such as viral infections, play a crucial role. Viruses like enteroviruses and rubella virus have been implicated. These viruses may cause the immune system to attack beta cells. More research is needed to establish definitive links. Decoding type 2 diabetes, a multifactorial condition. Type 2 diabetes is a complex disorder involving genetic susceptibility, insulin resistance, and lifestyle factors. Unlike type 1 diabetes, individuals with type 2 diabetes produce insulin but don't use it effectively. Over time, the pancreas may lose its ability to produce enough insulin. Family history and lifestyle factors play significant roles in type 2 diabetes. Physical inactivity, obesity, and unhealthy eating habits increase the risk. Age, ethnicity, and certain medical conditions also contribute to the risk. Gestational diabetes, hormonal shifts and risk factors. Gestational diabetes arises from hormonal changes, insulin resistance, and genetic predisposition. The placenta produces hormones that interfere with insulin response. These hormones can lead to insulin resistance. The pancreas may not keep up, causing elevated blood sugar levels. Risk factors include family history, obesity, age, and certain ethnicities. Previous gestational diabetes or prediabetes also increase risk. Women with gestational diabetes have a higher risk of type 2 diabetes. Their children are at risk of obesity and type 2 diabetes. Section 4. Shared risk factors. Connecting the dots. Shared risk factors for diabetes include family history, obesity, physical inactivity, age, and ethnicity. Understanding these factors helps in raising awareness and promoting preventive measures globally. Recognizing the red flags. Symptoms of diabetes. Diabetes can manifest in various ways, from subtle to severe symptoms. Frequent urination, especially at night, is common. High blood sugar leads to increased urine output. This causes dehydration and excessive thirst. Fatigue is another common symptom. The body can't use glucose effectively for energy. Section 2. Type 1. Diabetes, a sudden onset. Type 1 diabetes is an autoimmune condition with a rapid onset of symptoms. The body's immune system attacks insulin-producing cells, leading to a lack of insulin. Without insulin, glucose can't enter cells, causing high blood sugar and symptoms. Unexplained weight loss and increased hunger are common symptoms. Unlike type 1 diabetes, type 2 and gestational diabetes develop gradually, with subtle symptoms often overlooked. Insulin resistance, a hallmark of type 2 diabetes, develops slowly, with the pancreas initially compensating by producing more insulin. As insulin resistance progresses, blood sugar levels rise, leading to symptoms. Early symptoms are often mild and attributed to stress, aging, or lifestyle choices. Increased thirst and frequent urination are common symptoms, similar to type 1 diabetes. These symptoms may be less severe and develop more gradually in type 2 and gestational diabetes. Blurred vision occurs when high blood sugar affects the fluid balance in the eye. Slow healing sores or cuts are another red flag for type 2 and gestational diabetes. High blood sugar impairs circulation and healing, making minor cuts slow to heal and prone to infection. Diagnosing diabetes involves medical history, review physical examination, and laboratory tests. Healthcare providers ask about symptoms, family history, medical conditions, and lifestyle factors. During the physical examination, the doctor checks for signs like high blood pressure, obesity, and skin changes. Laboratory tests confirm the diagnosis and determine the type of diabetes. The fasting plasma glucose (FPG) test measures blood sugar after an overnight fast. A fasting plasma glucose level of 126 mg/dl or higher on 2 occasions indicates diabetes. The oral glucose tolerance test (OGTT) measures the body's response to sugar. This test involves fasting overnight and drinking a sugary drink. Blood sugar levels are measured over the next 2 to 3 hours. A 2-hour blood sugar level of 200 mg/dl or higher indicates diabetes. The A1C test provides an average blood sugar level over the past 2 to 3 months. An A1C level of 6.5% or higher on 2 tests indicates diabetes. These tests help healthcare providers diagnose and manage diabetes effectively. Managing diabetes involves lifestyle modifications, medication adherence, regular monitoring, and proactive self-care. It's a lifelong commitment requiring active participation in healthcare. The primary goal is to keep blood sugar levels within a healthy range, preventing complications. Achieving this goal involves a multifaceted approach tailored to the individual's type of diabetes and lifestyle. Lifestyle modifications, including healthy eating, regular physical activity, and weight management, are crucial. These modifications help regulate blood sugar, improve insulin sensitivity, and enhance overall well-being. Medications, including insulin and other glucose-lowering drugs, play a crucial role, especially for type 1 diabetes. The choice of medication depends on the type of diabetes and individual needs. Lifestyle modifications are integral to managing diabetes, empowering individuals to take control of their health. These modifications help regulate blood sugar levels, improve overall health, and reduce complications. Healthy eating focuses on balanced meals rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Nutrient-dense foods provide energy, fiber, and essential vitamins and minerals. Portion control is important to prevent blood sugar spikes. Working with a dietitian or diabetes educator helps develop a personalized meal plan. Regular physical activity improves insulin sensitivity, aids in weight management, and reduces cardiovascular risk. Engaging in 150 minutes of moderate-intensity aerobic activity or 75 minutes of vigorous intensity activity per week is recommended. Weight management is crucial for improving insulin sensitivity and reducing complications. Even a modest weight loss can significantly improve blood sugar control. These lifestyle changes form the cornerstone of diabetes management. Medications play a vital role in diabetes management, helping achieve healthy blood sugar levels. The choice of medication depends on the type of diabetes and individual needs. Insulin therapy is essential for type 1 diabetes, as their bodies produce little to no insulin. Insulin helps cells absorb glucose from the bloodstream. For type 2 diabetes, medications may improve insulin sensitivity, increase insulin production, or slow carbohydrate absorption. These medications work in different ways to lower blood sugar levels. Metformin improves insulin sensitivity, helping cells utilize insulin effectively. Sulfonylureas and meglitinides stimulate the pancreas to produce more insulin. Alpha-glucosidase inhibitors slow carbohydrate digestion and absorption. GLP-1 receptor agonists and DPP-4 inhibitors mimic hormones that regulate blood sugar. These medications often promote weight loss and reduce cardiovascular risk. Tailoring treatment plans to each patient's needs is crucial for effective management. Monitoring blood sugar levels regularly is crucial for diabetes management. Self-monitoring empowers individuals to make informed decisions and adjust treatment plans. Blood glucose meters measure blood sugar levels from a finger prick blood sample. Individuals typically check their blood sugar levels multiple times a day. Continuous glucose monitoring, CGM systems, provide real-time readings throughout the day and night, These systems use a small sensor inserted under the skin to measure glucose levels. Monitoring blood pressure and cholesterol levels is also important. Foot care is crucial, as diabetes can damage nerves and blood vessels in the feet. Regular foot exams, proper footwear, and foot hygiene prevent complications. Annual eye exams detect and manage diabetic retinopathy. Monitoring and self-care empower individuals to manage diabetes effectively. Preventing diabetes is an empowering journey of making conscious choices that prioritize health. Adopting a proactive approach to lifestyle modifications can reduce the risk of type 2 diabetes. Prevention involves sustainable, long-term changes integrated into everyday life. Shifting mindsets from reactive to proactive, from managing symptoms to cultivating health, is key. Understanding the interplay of genetic predisposition and lifestyle factors is crucial. Genetics may determine susceptibility, but lifestyle choices influence gene expression. Adopting healthy habits can effectively reduce diabetes risk. Embrace a proactive approach to health and well-being to prevent diabetes. Lifestyle interventions empower individuals to take control of their health and reduce diabetes risk. These interventions, supported by scientific evidence, provide a roadmap for prevention. Adopting a healthy eating pattern is impactful for diabetes prevention. Prioritize whole, unprocessed foods and limit processed foods, sugary drinks, and unhealthy fats. Nutrient-dense foods support overall health and regulate blood sugar levels. Regular physical activity enhances insulin sensitivity and aids in weight management. Engage in 150 minutes of moderate-intensity aerobic activity or 75 minutes of vigorous intensity activity per week. Finding enjoyable activities makes physical activity a sustainable habit. Weight management is crucial for reducing diabetes risk. Losing even a modest amount of weight can improve insulin sensitivity and lower blood sugar levels. Preventing type 1 diabetes, an autoimmune condition, presents unique challenges. Unlike type 2 diabetes, the exact causes of type 1 diabetes remain elusive. Researchers are investigating potential risk factors and interventions to delay or prevent its onset. Genetic predisposition plays a significant role, but environmental factors trigger the autoimmune response. Certain viral infections may increase the risk of type 1 diabetes. Other factors like early exposure to cow's milk protein and vitamin D deficiency are being studied. Focusing on overall health, including breastfeeding and promoting a healthy gut microbiome, may offer benefits. Research continues to unravel the complexities of type 1 diabetes. Preventing gestational diabetes is crucial for safeguarding the health of both mother and baby. Adopting a proactive approach to lifestyle modifications before and during pregnancy can reduce the risk. Maintaining a healthy weight before pregnancy is effective in reducing the risk. Women who are overweight or obese have a higher risk of developing gestational diabetes. Losing a modest amount of weight before conception can improve insulin sensitivity. Regular physical activity before and during pregnancy helps manage weight gain and improve insulin sensitivity. Aim for 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity activity per week. Eating a healthy, balanced diet is paramount for preventing gestational diabetes. Focus on consuming fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit processed foods, sugary drinks, and unhealthy fats. Nutrient-dense foods support the growing baby's needs and regulate blood sugar levels. A proactive approach to lifestyle modifications promotes a healthier pregnancy journey. A knowledge is power in understanding diabetes. By arming ourselves with information, we empower ourselves to make informed decisions. Diabetes requires lifelong management, but doesn't have to define us. We've explored the different types, causes, symptoms, and management strategies. Type 1 diabetes arises from the immune system attacking insulin-producing cells. Type 2 diabetes develops gradually due to insulin resistance and impaired insulin secretion. Gestational diabetes occurs during pregnancy, affecting both mother and child. Risk factors include family history, genetics, lifestyle choices, and certain medical conditions. Some risk factors are beyond our control, but others, like maintaining a healthy weight and regular physical activity, are within our grasp. Embrace a proactive approach to health and well-being to manage and prevent diabetes. Advancements in diabetes care. Groundbreaking advancements in diabetes care and research fuel hope for a healthier future. Continuous glucose monitoring and insulin pumps revolutionize diabetes management. Emerging therapies like stem cell therapy hold immense promise. These advancements transform diabetes care, improving millions of lives. Supporting the diabetes community. Managing diabetes is a collective effort, thriving on support, understanding, and shared experiences. The diabetes community provides invaluable resources, encouragement, and a sense of belonging. Connecting with others offers emotional support, practical tips, and empowerment. Local support groups and online forums foster a sense of community. Healthcare professionals provide personalized guidance, education, and support. They offer evidence-based information and compassionate care. Advocacy raises awareness, supports research, and drives progress. Together, we can amplify voices and work toward a future free from diabetes. Don't forget to like, share, and subscribe to support our cause and stay informed.